Right. From the beginning. All right. So let me just go ahead. All right, everybody. So my name is Dr. Jane Manfredi, and I am at Michigan State University College of Veterinary Medicine. I am the Marion McPhail Dressage Chair in Equine Sports Medicine. And I'll tell you a little bit about that at the start of this talk. And I was kind of asked to talk a little bit about like relevant current research in horse rider and tack interactions. But I can talk about many, many other topics too, and I'm happy to do so. I just want to see here for 1 second. I want to get chat up. I will try to be kind of monitoring the chat, but if, Bethany and Lynn and Jen, if you guys see something come up in chat as a question, please like call it out to me if I don't respond to it, because I don't want to miss anything that you guys are seeing, if that makes sense, or have questions about. And we are a small and mighty group, so if you guys have questions, please do put it in the chat, or you could unmute and say things as well. I really, really want to answer the questions you all have tonight about what will really help you in your riding and working with your horses. And so I am at Michigan State. I am a veterinarian. I am also a horseback rider and have my own mare that you will see who's featured quite prominently here. And I mainly work on sports medicine cases now in the hospital, but I'm also trained as a large animal surgeon as well. And so I do want to credit Marion McPhail. Some of you may realize she just kind of passed over the summer, unfortunately, but she had a vision of basically my position being able to do teaching, research, and outreach to kind of spread kind of the novel amount of research and reach to different audiences. And so it's kind of a combination of performing research and teaching to basically help engage you all as the dressage community, learn what's new and what is like going to help increase our horses' welfare and academic performance. So my goal is that everything I do outside of the dressage sandbox like really helps improve performance, welfare of horses and riders inside the sandbox. Because we all know we want our partners to last a long time. So the mare I have up there, I should say she's 18 now and still doing FEI level work. Had a little pause, but we're back to it again. And my previous horses, I was competing and showing Grand Prix in 21, 22 years of age. So I like to keep everyone happy and healthy for a long time. And so I have a couple of these slides that are kind of interactive for the night, which you guys can either text in for, but also I'm happy for you guys to type it into the chat. But the one question I always like to ask the groups is really, I'm trying to take a pulse of the dressage community and say, what are pressing horse and rider health challenges or questions related to dressage training, performance, welfare, would you like to see more research performed in? And so basically, I've been kind of taking a list of what everyone is saying and, going back to see like, how can I work this into the program? Where do I see there's like a lot of things or a lot of interest, and how can I serve the community? Because like really and truly, like I am in a service position. I'm like, how can I help benefit the community where they see it most? I obviously have things I'm interested in, but I'm also wanting to see what you guys have. So essentially, you can either type into chat, or there are some other polling things. So if you want to text the number 22333 and then type in Jane Manfredi 478, and then you can actually like type it in and we can see it pop up on the computer. All those things are valuable. Like I said, I do have a couple more slides, but happy for you guys to just put it in chat too. And I'm just going to take a couple of pictures. As you go through, and if you think of more topics, like please either email me or type it in here and we'll look for it later. But I do really want to hear what's important to you guys in the field. So go forward. Okay, hang on 1 second. Okay. And so my overarching interests are, rider, horse, and tack. Today we're going to be talking about those interactions, but I also look at whole horse elements, nose, mans, and pad, and girth placement. I'm keeping track of this because, looking at the whole horse and whole horse health is important too. And so kind of on the veterinary side of things, I'll have a brief thing about this, but just this allows you guys to ask me questions about it later if you want. I really am interested in looking at this intersection of equine endocrine disease and orthopedic disease in horses. And so do any of you guys have horses that have either equine metabolic syndrome or PPID or Cushing's? Has any of you had horses with those conditions? And put it into the chat. Okay, metabolic horse, yeah. Okay, some Cushing's. I would say about 20% of horses that are over the age of like 15 actually do have PPID. And the metabolic horses can actually come from even very, very young ages. And so, you know, for me, for some of my work, I look at how it affects like a performance horse. So yes, we worry about laminitis, but oh, MFM, we'll talk about that. Laminitis, we also talk about how this can lead into like ligament and tendon injuries, lameness issues, loss of condition, muscle atrophy, and actually even like breeding related issues with placenta changes and stuff like that. So from a veterinary perspective, this is very much of an area of interest in mine. And partly because this was my first pony, who you might notice is a little sweaty and very hairy looking. And this was like in like June. So this pony should not have had this much of a hair coat at that point in time. So she actually did have Cushing's and metabolic disease, and eventually did develop laminitis. I like that you're monitoring that work, Kathy. We can talk about that too. It's just one of my other horses here, and he had a lot of arthritis injuries to himself as we went on, and some shoeing things too, where I have an interest in that area. Someone before said they're interested in horseshoeing and quarter cracks and stuff, and so we do have farriers that I'm working with on some of those problems here too. So hypertrichosis, Katerina, is like the really super hairy, curly coat. So like the excessive hair that we see on our Cushing's horses. The technical term is hypertrichosis. So yeah, good. All right, so I put this picture up here. And this is me actually on my first horse. Like I literally bought him the day before and we went to this horse show, which is crazy when I think back on it now, but we did crazy things when we were younger, right? Does anyone see anything on him that's a little bit, yes, Jen, you got it right off the bat, or maybe that's Bethany. So a close-up of that is you can see his tongue is out, right? And so some of my initial interest in rider and tack interactions was related to this horse who actually had a severe tongue injury. So if you actually looked at his tongue, like the center part of it was scarred down to the point where he didn't have actually nerve sensation in the distal part of his tongue. So it would hang out of his mouth, not because he was resisting, but because he didn't even know it was hanging out of his mouth because of the tongue injury, presumably due to a bit at some point in his past. And then for this horse here, so this is actually my Grand Prix horse and my trainer, Steve Olgamoth, during my wedding. He was the flower horse. Can anyone see anything with him that would relate to maybe like a tack issue or concern or challenge potentially? Withers, yes. Okay. So yes, not only super tall withers, but you know, some atrophy on either side of them. He was, you know, very much a challenge for saddle fit. Good. All right. So I thought we start out by talking about the saddle and some of the kind of research that's recent about the saddle. And this is, some of you might have seen some of the links from my previous talk. This is, I'm adding this in because this is kind of hot off the presses. But I always laugh when I get my saddle fit that I'm like Princess in the Pea, and I feel like small changes I can pick up on it. And I sometimes feel like Sally like laughs at me and says, this, okay, so hang on, I'm taking a picture. Like, you know, oh, sure, Jane, sure. And then she's like, no, okay, I kind of believe you actually can feel the differences here. And so in this study, they actually took same horses and riders, and they had a saddle that they kind of modified to either change the depth of the seat, the size of the flap, or the thickness of the panels. And what they found was that actually riders are really good at picking up differences, and that actually does change how the rider's pelvis works in the saddle, and also how much like the range of motion in the horse's legs, like how much they go like flexing versus extending in the horse's legs, based on these small changes in saddle positioning. So, you know, when we talk about saddle and saddle fit, like we really can make a difference, and small things can make a big difference. Okay, so I have a poll question up here now. Saddles tend to slip towards the side of the lame leg. True or false? You guys can either text and vote, or you can type it into chat. We have a true, we have a false, we have no idea, we have a true. True, 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 bunch of true. I don't know. Good. Good. So the trues have it, and it is true. So about, I think it's about 80% of the time, 86% of the time, saddles actually slip to the side of the lame leg. So it may not be a saddle fit issue. It may be a combination of horse rider saddle interaction issue. And so in this horse here, can you all see what side has the saddle slipped to? The left. Perfect. Do you guys see anything else about here which would make you concerned about like a left-sided lameness in this picture? Yeah, the tail is also to the left. So sometimes with lamenesses, the tail will tend to go to the side that's lame as well. We don't know why, the tail pointing. Good. And so what we know is that this saddle slip is actually worse with a lighter rider on, and it's more pronounced if you're on circles and if you're in the rising trot. Okay. And so that doesn't have anything to do with the severity of the lameness, just the fact that they are lame. And so, yes, Kathy, so you can see actually here, Brooke, and we'll talk about this a little bit later, is that in compensation for the saddle slip left, she's collapsing right, trying to throw her, like her weight to that way. So it makes her very crooked and sore too. Now she's lucky because her husband's a chiropractor, so he helps straighten her out. But this is Brooke's horse, and he actually had an SI injury on the left-hand side, pretty pronounced. And so he takes a lot of maintenance to kind of keep him as even if he can. He's also, it doesn't help if you have a horse that has a wide back shape, that makes it even kind of more pronounced for saddle slip. And so Dyson did a very nice study where they saw that 86% of the time it slipped the lame leg. And then how we proved that was when she blocked the lameness out, the saddle slip stopped. So just kind of an extreme example here of some of the images from that study. All right, so what do we do about the saddle slip? So we're trying to address the lameness, you know, potentially there's some muscle atrophy, like, you know, it takes a little bit of time for any of our intra-articular or other kind of therapies to work. How do we help correct this in the meantime? So if you have a horse that has steeply angled withers, typically we talk about shimming the diagonal. So rear on the side it slips to and the opposite front. But if a horse is more mutton withered or flat withered, we're looking at shimming the same side front and back. And when I say shimming, it's normally inserting either felts or like kind of these thicker plastic shapes into like a mattis pad or a thin line pad to help kind of balance things out. Everyone always loves to put in like the pillow quilts and things like that, but I would recommend against that because those tend to like move and shift and like can press down quite a bit. So truly, I think a valuable asset to anyone's tack room would be a pad that they can do some shimming on. And so they can do that while the horse is rebuilding strength on that side. So the question, Tanya, if the saddle is correctly fitted, we should not have to use a half pad and shim, correct? So the shim for sure not. The half pads we know, certain of them, and I have it in a slide later, actually will kind of dull the forces that the horse's back feels, right? So even if it's completely nicely fitted, by adding the half pad, you can still decrease some of the forces that's experienced on the horse's back, which to me is never a bad thing. But it is true if the saddle is correctly fitted, hopefully that should be low enough pressures already. And so we want to kind of keep them below like a, 11 to 20 PSI. And I'll show you a couple things about that in a minute. So you don't have to, but having the ability to do the shimming when you need it is important. Yeah. Yoga mat would probably be fine, Kathy. Just the, ability to have it not move though. So that's where I really like those pads, because you can put it in those pads and it has a pocket. So it stays in one place more accurately. Good. So some of the research we do here with saddle fit and or rider activity and movement, we actually use a Novell play-on saddle pressure mat. And so that is that kind of thin tan thing that you can see underneath the saddle here. And so basically we have a kind of a Bluetooth pack that now we have a very lovely saddle pad that we can fit it in. It used to have to sit on the rider. And so essentially when horses are riding, you can just ride regularly. And as she's riding there, let's see if I can go to this link. Can you guys, oh, sorry, I didn't sign in first. I apologize for that. Give me 1 second, bear with me. 1675. We get a kind of an in-time readout with it. And so this is kind of a saddle you'll see in a minute as we're going. We get kind of this readout of colors. And so we want the colors to be in the greens and the blues. That's kind of the nice area. If we start getting yellows and reds and pinks, we know we have areas of high pressure. So it kind of gives us a way to see, is the saddle fitting or not? Is there like a specific way? Is it shimming or rocking or bridging? And then helps us with performance cases. So if you come into me for a performance issue, we'll oftentimes look at saddle fit in this way objectively to try and see if that's part of the problem. You can also use, though, what you can have at home, which can be helpful. It doesn't show you the dynamic amounts, but can show you focal pressure point, is a Port Lewis pad. So these are kind of like inside there, there's like this kind of thick viscous gel material, sandy gel material. And it starts out all red. And then after you ride in it for 20 minutes or so, if you take the saddle off, you guys can see how now there's those clear areas there. So those clear areas are areas of high pressure where they've literally pushed all the material away from the saddle. And so this is something that's more available to y'all on a regular basis. I think it's like $250, $300 or whatnot. So if you have a horse that's really hard to fit or having a lot of issues, this is a way to say, do I need to get someone, a fitter in here sooner or not? Okay. So, you know, when I talk about it, that previous horse that we saw just running around actually had fractured withers. And so in this top left-hand side, this is what the saddle looks like before we did any shimming. And so in that front right-hand area where his withers actually have kind of fallen over and has a bulge, he had quite this area of pressure. And so then we were able to kind of do kind of serial shimming to go from that top left all the way down to this bottom right, where we can see most of our pressures the horse was experiencing were in like the, you know, yellow, blues, and greens, and much more comfortable for that horse. All right, so everybody here, I'm gonna have you type into there. What do you see happening in this to this saddle? So what do you see happening here? Okay, yes, Jenner Bethany again shows it again. It's just like popping off the back. Yep, absolutely. The camel is rising up and down, right? And so you can see that this is an issue. And so how do you think my sit trot is going to be if this is what the saddle wants to do? It's not going to be fantastic, right? So awesome knot is correct, right? So this is actually me in my mare with one of the saddles that when I first started with her was fine, but before we got into work, and then just rapidly started to not fit great. Not, I always blame my sit trot being terrible on me, but sometimes the saddle is involved, right? Okay. So where does this matter? So muscle atrophy, kissing spines, muscle pains, wither fractures, lameness recovery, right? And so we want our saddle to work for us to really help us, you know, keep either the horse going or rehab them when they have these problems. And so, you know, we now have some different saddle types and the ability of shimming to like put pressure in different areas to help still like distribute the pressure, but not put a focal pain where we have an injury. Okay. Okay, so saddle fitting is an issue. There is a decent number of ill-fitting saddles. And probably the biggest ones I see more so is bridging, where they actually don't have pressure. If you put your hand up under the panel, they actually have like a space where they don't have pressure. They have pressure in the front and the back, but not in the middle. But twisting can be fairly common too. So has anyone seen like these white hairs on their horses before or on other people's horses? Yes. All right. So most of the time, it can be from blankets, but it can also be from saddles. So, you know, my own horse particularly like was going, and I was in vet school, and I was like, one day he was like, wow, he's really resisting, having trouble and whatnot. And, you know, I brought him in for lameness and he seemed to be okay. So I kept riding him, and then, you know, did look or start to look at the saddle, and then realized it actually had like broken its part of his gullet. And so where he felt he was painful on his back actually brought some white hairs up. And so, you know, there's different kind of things. I won't go too much into saddle fit because I do want to talk about the other parts of the saddle, but there has been a lot of like research looking into saddle fit and looking at if the saddle is too wide, it causes a lot of pressure on horses like T13 and like the thoracolumbar, like the apaxial muscles, like kind of above its flank. And then narrow saddles kind of went further back with their cause of injury. Sorry, I think I said it wrong. So T13 is kind of in the middle of the back, and then narrow saddles called more of issue by the last rib. It also kind of affects the horse's range of motion. So if we want to get their backs up and kind of have, you know, more mobility in the backs, having a saddle that doesn't fit either too wide or too narrow is really going to limit the ability of the horse to move under saddle. All right, so how many, go ahead. Does someone have a question? Okay, so how many times a year do you have your saddle fit? 6 months, 2 times a year? Once a year, good. I mean, I tell you, I wish that's fair. That is fair. Good, when they can get there. Okay. Good. So, you know, what's the ideal? Like, so it depends on the animal and the horse. And like, I have totally been in areas where when I went to vet school in Canada, the fitters came once a year and that's what you got, right? But you know, if you're able to have it looked at, like, you know, once or twice a year would be ideal. But if your horse is recovering from an injury or some time off, like their back shape is going to change a lot more frequently. And so then you might want to get, next slide. Then you might want to do it more frequently. So also if they're younger or youngsters, yes, that was giving away. Youngsters too would also potentially need more frequent assessments of fit. So the one thing I do want to share with everybody is that when you get it, it shouldn't just be a static assessment. Like you should have them, you know, the fitters do a sternal lift, and then you should also ride the horse, because we know back shape changes with time and it tends to get like broader and wider after 20 to 30 minutes of exercise. So please, please, if you are getting your saddles fit, do actually ride them and spend some time in them. And sternal lift, Vana, is when essentially, so if they were sitting with the saddle on, you go and you kind of scratch under their belly by their girth area, their sternums, like under their kind of just behind where the girth would sit, and ask them to kind of like lift up their back like we hope they do when we're getting them to go and move under saddle, so that they're kind of using their core to raise up their back and engage. And so that can change, you know, how the saddle fits in those horses. I've seen a lot of saddles seem like they fit fine when they're just kind of standing there and their back is like this. And then when their back comes up, all of a sudden now we have the cantle lifting off, and the whole saddle's balance is tipping forward quite a bit. Yes, Megan, absolutely. Young horses need to be fitted more often because of growth. So I do, Tanya, I tend to have them do sternal lift in the beginning, just because that gives you an idea of what things are going to look like after they're being ridden. So if you kind of do that and do sternal lift in the beginning, it's already not great. Then I sometimes have them do some more corrections then, and then get on and ride and see. So I tend to do that as kind of a rough test after, you know, you do some of the beginning work before you get on ride. Okay, so the dry area under the saddle, is this an area of high or low pressure, potentially? If you're wearing a pad, I should say. I think it's about 50-50 between high and low to everybody, okay? So if you're wearing, you know, kind of like a traditional like saddle pad underneath the saddle, if you have areas like this that are appearing to be dry and don't have sweat, it's actually an area of high pressure. So it's to the point where essentially you have compressed the ability to like the sweat glands to actually sweat. And so, you know, when you see this, like ideally we would have uniform sweat along the length of the panel. So if you have a certain area that's like this, then you do worry that there's a high pressure there. Is the cantle lift without a rider a fit issue? Stay with lunging lifts, but not with the rider. That's probably a degree of which degree. A little bit of lift could be okay, but more than that is not. So like I've seen some saddles that come flying off the back when you kind of do the lift, and that's probably not great. If it's coming up like a centimeter or less, it's probably fine. You know, obviously the best thing is to look at it when you're doing riding and posting trot, like I was doing there, but a little lift could be okay, but you don't want to do too much. Good. And so again, I just have everyone, you go home, like actually palpate, put your hand down, hold it slightly down on the top of the saddle and feel from the front and back along the panels and start training yourself for the feel to see, am I having equal contact or does it feel like there's less pressure in certain areas than not? So it sounds like many of you are probably knowledgeable about this and like this is just a feel you can build over time. And I try to, you know, work with the fitter to evaluate that too. Because in this case, this is an example of a saddle that was bridging. So you guys can see we have kind of these pink peaks in the front and the back and the center dip under. So it's an example of a saddle that was doing the bridging moments where they didn't have good contact in the middle of the panels. I do want to just mention back pain briefly. So in jumping horses, we actually do see that when they are landing, they have really high pressures on their back. So above the level of which you could see pain being instituted. So again, if any of you do any jumping on the side, we really want saddles that fit well because landing is really hard on them. We did do a little work on girths, and so not we, but there has been a little work done on girths. And basically some of the areas that they've seen the highest pressures have been just behind the elbow. So some of the anatomic girths, the girths that kind of limit the amount of leather just behind the elbow that have little cutbacks and stuff have come into favor after this study. And so that is something I definitely am aware of now when watching horses go, and if they're having issues, is saying like, if the saddle looks okay, hey, let's just take a minute and peek at your girth. The one thing I'll say with the girths is some of them have a really exaggerated kind of belly section. I always have riders like actually like put your hand in that area because sometimes that really exaggerated belly section is not actually contacting the horse's abdomen. And there's like a big gaping hole there. And so then essentially you do just have a little string of pressure going from one side to the other side. So if you have that, like make sure it fits your horse's body shape and it's actually doing its job. And these are just some, again, pressure readings where you can see here high in purple areas behind the elbow that were uncomfortable. Yes, Lynn too, I agree. Actually, yes. Or you can see the front or back edge is not equal in pressure as well. That absolutely you can see with the girths too. So people are starting to think a little bit more about girths. I actually would love to do some of the some studies on some of the newer types nowadays. Yes, the fuzzy girths and not leather. And that's what I want to really do, Stuart. Like I really want to put on the fuzzy girths. I want to put on like the white like rope girths and alternatives leather to see if that makes a difference too. So we need to do more of that. I'm going to take a picture of that to remind myself, Stuart, that we need to do that sooner versus later. So thank you. See, yes, and Wintec, elastic versus leather, absolutely. We don't necessarily know. I think there's one study, but can't remember. So someone was talking about pads and half pads and what they do. And so this study looked at kind of a variety of brands. And so, oh, come here. So all the pads except for this A Cavallo gel pad, all these other options did actually lower pressure on the horse's back. Okay. So other than the control saddle pad cloth. Okay, so everything else like the Equine, the Mattis half pad, the Windrum pad, they all, and the puffy pad, they all helped decrease the pressure on the horse's back. And so, you know, even just that thicker pad could be there and could potentially help. So if you do have a well-fit saddle though, I do say like make sure it fits with whatever types of pads you normally ride in, whether you do half pad or not, or a thick puffy pad or not, make sure you fit the saddle with the pad you typically use. So yes, Jim, because they can narrow the saddle or Bethany. So like I said, it's always a combination of the saddle with the pad, as far as that goes. And then the one thing was this range of motion comment. And so that's really like how stable the rider is in the saddle. And so with this thick puffy pad, they did say that potentially the rider's stability was a little compromised in that thick puffy pad, which makes a little bit of sense. I think back now in my 100 jumper days, they used to have us ride in like kind of Western square pads with like really thick, like foam. And I just felt like I was swimming all over the place in them. And I think that's kind of an exaggerated idea of what we would see in the thicker puffy pads. So yeah, so the half pads were used in addition to this, like just the cotton pad. And I realized there is a little bit of thickness that would change how the fit would be, except for C. C was just used by itself. Yeah, so the back on track pads, Stuart, are a good question. So I use the back on track pads not for the ceramic inserts, but just because I think they're a little stiffer pad. So what I found with those is that subjectively, like they don't like shift as much and they don't like scunch under the saddle sometimes as much. And they're a little bit thicker than some of the cotton pads, but not as thick as this pillow. So that truly is actually my preferred saddle pad for my own personal mare, but I haven't done any research into like the ceramic part of it. But I will say, like, I would love her to ride. I have some really pretty pads and pretty colors and other companies like Lemieux and whatever, but she really likes the back on track pads and really complains when it's the other ones. So that again is totally, most of the stuff is peer reviewed literature. That is totally subjective, my opinion, for my personal mare. So I will put that out there too. So anyway, here you go. Okay, let's talk a little bit about thigh blocks. I'm like looking at the time, but the total saddle fit pad, Tanja, I haven't done, like, I haven't seen that research done on specifically that pad. I have thought about that. Okay, so I don't know like what to add to the equation on that one yet. Like, there's so many varieties of these things to look at. It's very hard to do sometimes. And then I'm just looking at the other comment. The neoprene helps you slip pressure on the withers, especially melon by the other guys. Smell loose. So definitely, I think a pad selection does play into with the conformation of the horse. So that would probably that would probably be some of your issues. Like if you have mutton horse and you don't want it to slide, and so you're putting the neoprene to make it stick, but then there's some contact on the withers. I'm gonna say I think there's some like horse variables there. Like my mare does not like to have anything tight on her withers. That shuts her down. But if the saddle is moving quite a bit and it's not just a confirmation of the horse thing, then I think there may be some else or some in-depth things you need to do to look at your horse a little bit more. The Windrum pad was the one before that was thicker, which so Tanya, probably the total comfort probably would be similar to that, where it did decrease some of the pressure, but it also maybe affects the range of motion of the rider. Thigh blocks kind of have been popular or area of interest. So deformable means it's smushy, so it's not like rigid. So if you are pushing into it, it feels like a softer foam. So it will mold a little bit to your like thigh. So there's some thigh blocks that are just like solid, like not solid leather, but very rigid. The deformable ones, like you can kind of feel like you can squish it. If you were to pinch it like this, it would go in a little bit. Does that make sense? So they looked at these thigh blocks, and so the deformable ones seem to have a better effect on rider position and comfort. And Katerina, I couldn't have prompted you better for that. Okay. So in this case, they did not look at a no thigh block situation, but we just finished a study where we were looking at thigh blocks during passage and piaffe. And so horses and riders rode in their own saddles, and then they rode in the one saddle that basically the you can essentially take away the thigh blocks and put whatever thigh block you want. So it was like a flat thigh block, which is more like the kiefer and the Steuben. And then they had a deformable thigh block, and then they had like a rigid thigh block. And so we are right now looking at that data. So essentially we had them go, I'll play this for Lori right now. So we had them kind of wear the saddle mat while we had them either passaging or piaffing. And so I have markers, as you can see, on the horse and the rider to kind of look at their angles and their way of going under all the different conditions and to see how rider position changed with the different thigh blocks. So that is what we were working on right now, Katerina, and hopefully by this time next year, you will see a paper out about it. I don't like, we're still doing the data and I'm not unblinded yet, so I can't tell you the results of it yet. But I wanted to look at that. So we will see. Hopefully you guys stay tuned. Okay. All right, good. Cool. I was very excited. I got to work with lots of great people in Michigan to do that study. It was really funny. I brought the saddle to try it just because you could do the sty box, and like everyone then loved the saddle. And I was like, I really wasn't trying to sell you guys saddles. I was just trying to do the study, but they ended up getting a lot of them. So anyway, okay, stirrup irons. So this is another study I'd like to kind of update with some of the newer stirrup irons. But we looked at kind of a traditional one, and then one that kind of folded or bent, and then one that was like twisting and bendable. And basically we found out that riders had preferences for which ones they liked, but really functionally, there was not like a lot of differences on their position with the ones that were purported to help their position. So my gut is that like the riders that essentially had more arthritis like preferred the ones that did have some more give, but it really didn't change the position. It was just the rider perceived it to be more comfortable. However, there's some new stirrup irons that be good too. So let's talk a little bit of rider asymmetry. Like if a rider is asymmetric, they did try and do a study where they actually shortened the stirrup at one side. And it does actually have effects, surprise, surprise, on the horse itself, on their range of motion and how they can bend. So, you know, if you are asymmetric in the rider, you have different like lengths and size stirrups, that actually does affect how your horse's back moves. Correct, Jen. Yeah, so Jen or Bethany, like the wider stirrups like can be more stabilizing potentially. There's, you know, and there's new types of stirrups that have like kind of thicker pads and also have kind of the same kind of things you use on bikes, like mountain bikes, to like help hold you stable in the stirrup too. And no one has looked at those yet. So we're looking at how we can best kind of analyze the wider stirrup straps and the different types of stirrups, but so many projects, so little time, Stuart. That's what I'm saying. Yes, and so rider position, rider comfort is a big thing for me. So yes, and so some asymmetrical by inch in your legs, should you keep the stirrups the same lengths or make them fit to each other? And so those are really great questions, because the one study would say like, but if your legs physically don't go there, then that would, you know, is difficult too. So so the answer is like, if you're able to ride symmetrically, that is great. But if you are physically not symmetric yourself, like if you need to compensate for that in some way, is an open question. USDA won't support what the congenital for, I'm sorry, Kathy, I don't know what that comment was for. Oh, hip. Was it about the hip pain? Oh, prefer posting on on one diagonal. Oh, yes. Okay, sorry. Yes, sorry. So they did have the debate about posting or not posting. I think that's going to resurface again because Natalie Lamping is pretty supportive of being able to post, at least through like kind of third level ish. Um, and some of my interest in future, I'm working with some human people to like do some more of the biomechanics, and looking at arthritis in humans and how we can optimize our our tack to help that out. We're also talking to hopefully do a study with some of the para riders this coming season in Florida. Okay. All right, so moving on to rider. They would penalize the incorrect diagonal, Kathy. Yes, you're correct, probably. If they notice it. They may not always notice it, but if they did, they probably would. We'll talk about the incorrect diagonal in a second, actually, for a horse as well. So rider position, we always, kind of want that like shoulder, hip, heel alignment. And in the past, like some people have a chair seat depending on the types of saddles they're in. But the interesting thing is that we found out that the higher level dressage riders and the more years of riding, you actually are more asymmetric, right? So our goal is always to have this tremendous amount of asymmetry, but apparently that is really just for the youngsters. And so the older we get and the higher level you get, we are more asymmetric, but we still compensate probably. We're better able at compensating. So they kind of looked at a bunch of older level riders and saw this. So I found that interesting. I thought like, oh, well, we have pain but we're still more symmetric because we fight through it. And apparently, no, we just compensate in other ways. So they did look at like rider position normalish and not so normal. And so, essentially looking at how, people can collapse, and how they kind of torque their body as seen here. Yeah, so they have been some work looking at like some Pilates and yoga, like yoga balls and things like that. And that has been helpful, Marissa. So Dr. Clayton did a little bit of work with that too, a while ago, and did find that that can be helped. So you can improve those. The Franklin balls, you know what, like that should be another study, like how we, anyway, yes, I'm going to take a picture of that because like Susanna von Dietz, was playing with us with those the other day, or like the other day, like 2 years ago. And I did think about it at the time. Okay. Yep. And so, yeah, that is true. The dark gray horse, often the riders do reflect, horses do reflect us as riders. Yes. And so he probably is asymmetric too, a little bit like my student's horse in the first thing. So the issue with horse and tack, where again we start to have this interaction with your saddle, is when someone's looking at you in saddle fit and watching your horse go, like they need to be able to look at you as well as your horse, right? Because if you are doing you're collapsing the hip to the right, like this rider on the top, you're actually going to have get more forces on that left hand side of the saddle. And so when you're looking for saddle fit and when we're looking at studies, like you need to say like, okay, are we getting this hot spot there because I'm riding so crookedly that I'm overweighting one side of my horse's body? It's not really a saddle problem, it's a rider problem. And so riders can also totally tilt. And if case you have the rider tilting both ways, is in that bottom image, it will be like more saddle pressure, like back pressure on the side that you're tilting towards. So really working with your trainer, and your saddle fitter and your veterinarian is really important to assessing causes of horses' back pain. Okay, we'll go for this. So not a lot has been done so far looking at actual like advanced movements in dressage and riders positions. Like I'm trying to do a little bit with Passage and Piaffe and add to that literature, but we do know in shoulder in that the more advanced you are as a rider, you have more hip extension and external rotation on the outside leg during the shoulder in compared to novices. And so that was kind of one of the positional things that we do know in like a normal perspective, that happens. So more like outwardly rotating your toe, and then like a greater hip extension, like a longer leg. Okay, so what gait or movement feels like more of a workout for you all? What gets your heart really pumping? Trot, canter, sit trot, extended trot. we always have the argument is like this really a sport? People have always like, oh, is this really a sport? Canter, we have a lot of canters. Good. Okay. Okay. And so, this is something that was looked at kind of more in Western horses, but faster trots and canter did have a higher metabolic rate. And then cutters and reiners actually had some of the kind of higher exercise levels. So riding is definitely exercise for us all. Um, this is a little bit during trot and passage. I want to be conscious of time because we're getting close to like a little bit of the end, but I do want to go to a couple of points here. So I may skip a few slides or summarize, but if you want to say, like, people always ask, like, what's the like least pressure that horses can get on their back? And so if you're looking at loading of their back, 2-point loads the back less than rising trot, which is less than sitting trot. So sitting trot is more the back forces on the horse's back. So if you have a horse that's recovering from something, kissing spines, etc., 2-point would be better if you're able to do it during that time. We're gonna skip that for a second. So people always ask, like, is it worse if I'm a young rider, novice rider versus experienced rider? Like, do they have differences in forces of impact on the saddle? And some, studies have supported that novice riders have higher impact on the saddle. And riders can influence lameness, so it can be exacerbated by your experience level and what you're doing with lameness. So if you were actually riding your horse in a lameness exam with the veterinarian, I often say, like, you should sit trot and you should post trot. You should post trot on the correct and incorrect diagonal if you have a veterinarian looking at it, because posting trot can actually like mimic a lameness position. So always like do walk and trot, sit trot, rising trot, change your diagonal to really help your veterinarian see if there's a lameness there. Okay. And I like to do this because a lot of the times, like, this horse had this particular behavior, which was not like, he was a little lame, but as you can see, the lameness was not necessarily leading to this issue that this horse was showing us here. We'll go for there. Okay. I also recommend that you all, if your horse is being looked at for, lameness, that you lunge and or ride the horse and do it at the canter, okay? And not just the trot, because the canter can kind of reveal some things that can lead to us to worry about back pain, pelvis pain, SI pain, etc. So if you can see here, he starts to bunny hop behind and he switched his leads a little bit behind as well. So some of those can be cues, like if he's cantering disunited, that there are some problems more proximally. Jen, so the previous horse that you saw that was stretching his head and neck out, he had two things. So he had actually gastric ulcers and caudal neck arthritis in his articular facets in his neck, cervical vertebra. He did have some minor lamenesses other places, but the biggest changes were after we got the ulcers under control and after we treated his neck. Good. So if you guys want to hang in for me for another kind of 10 minutes, we did take a few minutes up in the beginning talking about stuff. Good. So Katarina, so it can be training, but many times if they're doing that, like, I find there's a pain element. And the more that I go like about it, like, yes, you can try and have the trainer work through, but if it persists, to me, like, that's behavior that needs to be looked at by a veterinarian. And the more I do this, the sooner I go and say, let someone look at it first, because that horse, as soon as we injected his SI, within like a couple weeks, he was a very different horse. So yes, but don't get frustrated if you can. All right. And so bits, some of the exciting new stuff has come looking at like bits. So how many of you have heard, like, say, oh, or have a bias, and I kind of did too for a while, like, oh, the snaffle bridle, if you can ride him in the snaffle, and you should do it instead of the double is 2 bits. Maybe it's a little more severe. maybe you all haven't heard that, but at least in my area at the clinics, like when I would go and ride my mare and do the, you know, the 4th level or the pre St. George and the snaffle, I'm just like, oh, she's doing it in a snaffle. That's great. They actually did a study looking at kind of rein tension with snaffle reins, and double bridle reins, and they found that, okay, yes, at the headpiece, the crown piece, the double bridle, you know, was heavier because it had 2 bits, so there's more pressure there. But if you were looking at noseband pressure, it didn't matter between the 2 bits. And then if you looked at rein tension, even combined rein tension of the, you know, the Bradoon plus the curb was less than what you would have in the snaffle bridle. And so potentially this is due to experience of the people that are holding the doubles in this instance. So potentially if it's a more novice person with a double, that wouldn't be the way. But actually rein tension, so kind of the pressure against, you know, in your hands against the bit was less in a double bridle than in a snaffle. So what I take from this is like what works for your horse, what you're comfortable with, but don't feel like you're doing a bad thing for the horse's welfare by wearing a double, as long as you're capable in using your hands correctly with it in your horse. So Stuart, it's a good question about the new ones offering trigeminal or facial nerve relief actually helpful. I don't know that we have scientific proof that they are. I do say if we can have a bridle that's positioned away from putting pressure on those areas in the TMJ, that I think is ideal, but do I actually know that that is truly helping it? I do not. And so, you know, that is something that I said could be really important for some horses, especially ones that have tendencies towards head shaking. And some horses probably wouldn't care regardless. Does that make sense? Okay. Good. So, we did some, I'll just show you, this is cool drop nose. So the drop nose band cutting, what I worry about the drop nose band is that most of the time it comes on like the very thin bony part of the nose. And so when you put the drop on, you have 2 things. One, you could potentially compress by the nostrils of the horse. And then 2, it's like if you're putting a like a kind of a tight thing on a very thin bony prominence, it could be an issue. So I tend to avoid drop nose bands for those 2 reasons. But again, probably there's some horses that won't care. It's like some horses, doesn't matter what saddle you have them in, they're just going to do their thing. And some horses are really particular. And so it could make a difference when the horse that's maybe kind of having issues, airway issues, or has underlying airway issues as well. So I always like to show this because this is essentially what horses are doing, you know, with the bit in their mouth. So I'm standing behind this horse with my, you know, reins, kind of double lunging the horse in a variety of different bits. So, you know, here this bit is actually contacting his premolars, but he's just gently chewing on it. It's being very nice. I probably wouldn't be this nice if I was this horse and had metal hitting my teeth. But we'll see kind of a couple of different options. So this is like a moving radiograph, essentially. So the tongue is here. Here's the bit. Here's the hard palate. The horse is facing towards the right. And you know, his insides are down here at the bottom. So I think it's just always interesting, like, what are they actually doing? Yep, he has a flash. This one did have a flash. And so that's what that one was. And that flash was used mainly to hold these markers on, these 2 middle markers that help me take measurements. So it wasn't a flash to like have a flash, it was a flash to also help secure some piece of equipment that helped with some of the measurements I was taking. But yes. And so here's just a snaffle, and here's actually the horse is bulging the tongue over the bit a little bit. So we think they're either doing that to avoid pressure on their tongue or to protect their palate. It's a little bit hard to say. It could be for either of these reasons. And so he's retracting the tongue. And then this is with a KK right here. And this horse is pretty quiet with the KK in its mouth. The more rein tension you have, the more movements of the bit and the tongue and the mouth the horses do. So we saw that in our study, and other people have seen it since, that the more tension you have in your hands, the more some of these evasive behaviors become apparent. If you've ever seen a bit with like wear and tear on it or like bite marks, it's because they can lift it up and like kind of bite it. Yes, Tanya. So the bottom line from all is make sure your bit is fitting. appropriately, and then it's not too high up in the horse's mouth. And then it's also small enough to like be comfortable in the horse's mouth, especially when they have kind of smaller palates. Okay. Good. So the other thing I tell people or I share with people is that you can see right in this area here by my finger, there's kind of a sharp edge. Bits with time will get wear and tear. And so if you have a horse that's totally fine and normal and then starts head shaking one day, like one of the rule outs is like, is there a rough edges on the bit now, either at the, sides of the lips where the rings attach, or in this case, this is kind of like a KK-like bit, where he had it on the edges. And so this was catching the horse in the tongue, and the horse was obviously not happy about it. And we do have now documented proof that, like, again, horses that have cutouts behind their ears and thicker padding over their nose and their poll have less pressure there, and that makes it more comfortable for horses. All right, so we have much more on nose bands now than we used to. I was doing the bid study and I wanted to look at the nose bands, but I didn't graduate in enough time to be able to get the study done before other people. But we do, know that we have to add them, have like now like kind of 2 fingers of space, and be careful that they're not tightened enough close to like bony ridges to cause ulcers and things like that, which can be exacerbated if their teeth also have sharp points. So many of the horses that do have bits, have sharp points, and when you have the noseband pulling it against those sharp points, we worry about worsening these buccal ulcers. The milers, those was some of the ones were actually in the study I did in the videos that I was showing you. So the milers kind of act like regular bits. I will say, if they have really tall ports, you do have to like have them hang down with more than just, you can't have 2 wrinkles in the corner of the lip with a miler that has a big tall port, because it will be hitting the premolars. They don't really have independent side movement. They said they do. The only time I saw that was when the horse literally had like bit one side of the miler, and I was moving the other side with my hand. So they basically act like kind of regular bits. So I'm gonna say there. Okay. Some recent papers have actually shown mandible pressures are higher than nasal pressures. So that like underneath the jaw is more important than the top. And someone was talking about, do we need to pad more of the underside of the jaw? And the answer would be potentially yes. Yep. So so there's a noseband. I think I'm getting to that study in just a minute. Okay, this is with double versus Snapple. And so actually in the double versus Snapple, they found less pressures under the nose, and didn't see any difference underneath the chin itself. And so, yes, there was a study that looked at the length of stride, and I don't know if it's in here somewhere, it's probably in here somewhere, where the tighter it was, like the shorter the stride, which again is not desirable. And so that's really helped drive the ability to kind of use that tool to check the noseband tightness now, to make sure that it's like 2 fingers in distance. I will say there's been another paper that I don't know if I actually added to this, not, and I should, that said that doesn't actually, they didn't see the changes that study did. So there is a little bit of conflicting evidence right now, but for the most part, what is really published suggests that we should really probably have our nosebands looser than they were back in the 90s and 2000s. Okay. Let me see. So just bits can have a lot of different injuries, so keeping that in mind with tongues and whatnot. And they can be part of the rehab procedure too. So finally, just one last little thought. Can horses actually swallow with a bit in their mouths? And they can. We did some work on that. There was some question about like actually do bits in the horse's mouth compromise respiratory function? So this is some pictures of like looking at the horse's airways from a endoscope that we pass their nose while they're under the treadmill. And so they actually looked at that with a bitless bridle and or a bit, and they didn't see that those contributed more to like collapse of the airway. It was more like head and neck angle was the biggest factor towards a collapsing airway. And so this is my study. They can swallow with them. All right. So let's see. I'll just mention this one sneak of peek because it's exciting. It's not actually on the topic we just talked about, but if any of you have had horses that have osteoarthritis, very commonly, veterinarians have injected steroids into the joints. We've actually just demonstrated that horses that have intra-articular in the joint steroids, that have metabolic disease, so that have EMS and obesity issues and insulin issues, are more prone to really spiking high levels of insulin. So that's all in those like pink boxes there. And that is levels where we would be worried about potentially causing a laminitic episode. So this really kind of strengthens if your horse has EMS or metabolic disease, look for some other options for treating arthritis in joints. Okay, we've also done some work with a whole body rehabilitative body wrap, the Pro 6, and actually shown that it can have increases in the range of motion of the carpus and hock. Other options too would be kind of like some of the regenerative medicine things, which I think I actually didn't I put it in here? Maybe I didn't. So looking at things like ProStride, IRAP, PRP, they're more expensive, but they're probably safer. Arthrimid, Noltrex, things like that. Good. So just these are some of the ponies I've had in my lifetime, and I left the 50 this on here, and that's really bad of me. So forgive me for having that, but good. Sorry, that was like a whirlwind tour, but you guys asked some really good questions. What other questions do you guys have?
Jane, I have a question, Marissa.
Sure.
Lots of great information. In fact, my head is spinning, but I would ask what would you want me to leave with top 3 things?
So the top 3 things would be the bridle fit, like an evaluation of bridle fit is probably going to become more prominent in the coming years. And so actually looking at bit and bridle fit, I think is going to be a really important health welfare factor for your horse coming up. I would say with saddle fit, like understanding that there are horse causes for saddles to look like they're not right. There are saddle causes for saddles to look not right. And then there are rider effects on saddle and horse to make it look not right. So you really need to have a really good team between trainer, veterinarian, saddle fitter, etc., to pick out what pieces are like the main driving problem. And you have to be willing to understand it may be tweaking a couple of things as well. And then what else?
It could be top 2.
Yeah, those are probably
totally
the top 2. Those are totally good. And then yeah, so Stuart wants to know if like ice is helpful for micro tears and tendon injuries and stress ligaments. So to me, ice is never a bad thing in the horse. And horses are really different in humans. In humans, they say like 20 minutes on, 20 minutes off. Like horses with ice, horses can live in ice. Like if you think you have a horse that's foundering, we will keep them in ice for like continuously for 24 hours. So horses, they're supposed to live in the wild, they're supposed to live in snow, all these conditions. They can have it on for longer periods of time. So, post really hard works, or in the case of an injury, really having them in, an ice water mixture. And if you can have compression in there, that's probably even better. So I am a strong advocate of using like low tech methods for preventing injury or preventing worsening of injury as well. So
I have a question.
Go ahead.
Yeah, what is a good way to if you want to do a randomized trial or some sort of study? I mean, it just seems so hard to get a homogeneous group of horses or horses and trainers or horses and trainers and riders to do the studies. Even the studies you presented, it was like, well, but in a novice hand, maybe not, or in a good rider's hand, okay, and just really challenging. Like, how are you approaching that as doing these studies?
Yeah, so I mean, so some of these studies are admittedly, are on smaller number of creatures. So we do sometimes either use the same horse or the same rider. So you can sometimes use that approach. So for the study where I'm doing Passage and Piaffe, like essentially all of those are horses and riders that are like competing and showing at that level. So trying to, you know, like that's saying, okay, you all have to be, you know, you're doing the level of Passage and Piaffe, you're showing it, you're performing it regularly, to say, you know, that's like one good place. In those instances, we can also sometimes use the horses and riders their own control. Like, so for example, we have two controls in the study with Passage and Piaffe. One is when they're using their own tack currently, and then two, when they're using like the, you know, the no thigh block at all, compared to the other two different fly block types, right? So we sometimes do that to try and kind of improve our power to see differences. In vet med, yes, we would love it to be like in cows, where if I go to the dairy barn, I can have like 100 cows, you know, at a time in the same stage of milking, same age, same everything. And that's just unfortunately not the same way in vet med. That being said, you know, we're still able to see significant differences in many instances. And so we try our best to at least like kind of pair up individuals. And so in the study where I like alluded to differences between novice and expert riders, like that was intentionally designed to look at the differences between novice and expert riders. So really being intentional and clear about what outcome you are interested in, like when you're recruiting who's actually participating in your studies, helps you have the best chance of seeing something if there is something to see, if that makes sense. But it does, I would love to have a million more riders on each of these levels to go and look at some of these things, Jen. So you have definitely highlighted one of the challenges in doing research in this field for sure.
And I mean, how are the recovery protocols designed? I mean, when we inject humans with steroids in their joints, I don't say, hey, you need to lay in bed for 3 days and not go out and do your things. But now, you know, but the vets say the horses have to be up for 3 days and then they can go out in a small, you know, it just seems interesting how they design these like post-injections protocols or the post-injury protocols, but it doesn't, I just don't know if it's very uniform or how they came up with those numbers of days.
Yeah, yeah. And so, I mean, that's a really good, it's a good point. And so there's not necessarily a hard science behind all of those things, right? And so, you know, I'm like of the 3-day mindset, but one of the first people I trained over was it was a whole week that they couldn't do anything, right? So, the bottom line is I wish I could give you more, and most of us do like what we have seen and what we've been comfortable with. And then, you know, and or personal like experiences, like I've had joints injected before, and like for me, I was like, oh, it was 3 days before I wanted to do anything, right? With horses, I'll say partly it's because like in humans, you can say, hey, you can do stuff, but take it easy. But horses, like you don't want to have them have any forced exercise where you as a rider might push them beyond what they can, and you can then add to the inflammation burden, right? So I want to have the steroids have a like a chance to like start to take effect and not have a challenge in addition to that put on there. But yes, is there a difference between 1 day, 3 days, 7 days? I don't know. With the insulin, we looked and sampled them over the course of like, you know, essentially 3 days, et cetera, because of data that we saw in humans and some preliminary data we did looking at it in the horse over time. So sometimes like we have some pilot data which we kind of base our studies off of, or we try always to have pilot data we're basing our studies off of. So it's not like totally, you know, like arbitrary, if that makes sense, where we have a sense and a smaller number of what we should do or look at. Okay, let me go back into the chat for a second. So Kathy, have you incorporated AI yet? So we're working on some of the AI with some of the marker tracings, like for some of the biomechanics part of it. And there is some really nice, like, so for me, I use a lameness program called Schleip, which uses kind of like, you know, AI to track different positions on the horse to assess for lameness. So, and I think we're going to see more of that come into play with some of the predictors that we have. I'm doing some collaborating with some of the saddle stuff from the study we looked at, using some AI like predictability features too. So that will be more and more. Fairfax has done kind of a fair bit of work. The good news is I'm glad they're looking at doing the work. The flip side of that is that, like, yes, there's probably some bias in their product wanting to look potentially good, because they're doing the work. So I do though appreciate when companies want to actually like test what they're saying to see if it's true. So that being said, I do like their approach to, looking at girths and looking at bridles and things like that. But it's got to work for your horse, right? And so, certain horses, conformation shapes, back shapes, etc., like seem to be more appropriate to certain saddles than others. So, would I look at that one maybe a little bit first because I know they care a little bit more about it potentially, but it's also what's in your available in your area, and if you have someone that can actually like adjust it, etc. Okay. Anyone studied the position of noseband versus the bit rings? I always like paint structure. My noseband rests above the bit rings, but I see people. That's not really interesting, Megan. I don't think that anyone has. But that's kind of like a interesting question. I know sometimes what I have seen is like you start getting the silver from the bit rings like on the side of the noseband. The double bridle, I think you'd have more kind of interactions between those two as well. But so no, I don't know of anyone who studied that, and that's an interesting thing to think about. Clean injection site. Okay. Oh, Stuart, for like the 3 days off for the cleanage. So the skin should heal within 24 hours. And I'm sorry, Stuart, it's probably not actually Stuart now that I can see, but I don't, but anyway, but that the skin heals in about or closes in about 24 hours. So like 3 days later is a little bit probably more excessive than what you need. But yes, like that would prevent them from potentially going out and getting like hosed or stuff working, like definitely like the same day you want to avoid potentially getting it dirty. That being said, I did do a little mini study that I looked at essentially bacterial loads on coffin joints and hocks, like putting them in the stall, like 'cause sometimes like I used to wrap everything in elasticon after I injected it when I put it in the stall for 24 hours. And we looked at the bacterial burden, and the bacterial load on those areas without a wrap would not have gotten to the point where it would have risen to the level that it would cause infection. So I don't actually wrap anymore. And what I did find actually sometimes the wraps would get loose, and then like shavings and stuff would sit in there in contact like even more. And that made me a little bit uneasy. I do agree, Lynn, that horses mask their pain, and they're really good at like shoving their lameness in another place to compensate for pain in one area or another. And yes, I have used the lameness locator. I actually did use the lameness locator for many years, and I will still do it for research, but Schleip now also gives me readouts for research. And like for Schleip, all I have to do is go up and turn my cell phone on, right? And then I can video the horse, and it's good. Where's the lameness locator? I have a whole other like laptop and computer. I have things, I have to put a beanie on a horse's head. Putting beanies on horses' heads is one of those things I've learned that can be like take your like life in your hands moments at times. So Schleip allows me to kind of be removed from the horse and not have to worry about having those charged and say charged and things like that. So that is totally fine. And Schleip is, I'll spell it. Is an app. It's an expensive app. It's about $200 a month to like kind of maintain a license to be able to use it. But then like there's in smaller fees if you want to be able to like say you were worried about your horse for an extra $50 a month. I could have a certain number of people actually just send me videos like through Schleip to look at and evaluate too. So sometimes that can make it easier if there's a number of horses you want to be able to look at regularly. A saddle wool panel. Yeah, wool panels can be totally fine. And this is the one exception. That's why I said, Emily, before, like I was saying, if you see that dry spot in one area and not other areas, and you're using like a cotton pad, it's high pressure, because wool saddles can actually pull the water out. And so but they should still be uniformly then pulling the water out. Like it shouldn't be just looking like it's dry in one area and sweating in other areas. It should be like along the paddle where the wool panel contacts. It should be dry. Absolutely. And I'm fine with wool panels. I'm mainly like things that I can like flock and move things around and replace, because I'm a big one with saddle shape, like horse shape changes. And so if you get, some of the ones that have like the foam, it fits perfectly at the time. And then 6 months or a year later, like you could have a different horse. And then now what are you going to do? Well, now you're left to shimming the saddles or getting a new saddle. So I tend to like options. My husband will share, like, I like options. And so, yeah, that's good too.
Well, thank you so much.
Yeah.
This has been amazing. It was
So,
really,
no.
really, really interesting.
Good. No, I'm happy to be here. If you guys have other questions or think of other things, always willing. Just I'll put my email again one more time in the chat. And hopefully you guys learned a lot. If you think of anything else you want me to do or questions, please go ahead and email me. And thank you all for joining this evening.
Thank you.
Thank you.
You're welcome.
Have a good night, everybody.
Good night. Thank you,
Good
Jane.
night. Thank you.